I want to talk for a few minutes, Madam President, about the announcement yesterday of how many people have signed up for the President's health care plan. And I would just like to say, as I said when the website wouldn't work, it's not about whether the website works or not. Frankly, it's not even about how many people sign up. This is about whether this is the right direction for us to go as a country. Is this health care more affordable, and will more people be insured, and will the people that are insured be insured with policies they can afford and coverage they want? Now, the President, of course, and everybody understands the website had its problems, and I think we'd be really remiss if we decided if making the website work was a test of the program, or frankly making people sign up was a test of the program. This debate is not over. It shouldn't be over. We need to continue to look for ways to try to make this work better, because I certainly continue to hear from Missourians who tell me that the course we're on is hurting their families, hurting their job opportunities. The law of unintended consequences appears to be the law here that is most likely to be applied. The unintended consequences of people who are going to work part-time, the unintended consequences of people who are looking at a job that used to be a full-time job, but now, the government said you don't have to provide benefits unless somebody works 30 hours a week. And I guess what the government really said was you have to provide benefits when they do work 30 hours a week. But people immediately look at that, and the society adjusts to that government determination. And so suddenly people are working 28 and 29 and 20 hours without benefits, where they might have been working those same hours before with some level of benefit, or might have, more importantly for their families, been working full-time before. We're going to continue to talk about this law and how it serves people. Let me just give you a couple of quick examples as I conclude here this morning. I had a person in the office this morning who was here for another purpose. He's a radiologist from Cape Girardeau, Missouri, and he said his insurance was going to go up $500 a month, and that was the notice they had got for the same coverage until the President made the decision to suspend the law, a totally different debate topic, whether the President can do that or not. But when the President suspended the application of this law, which everybody's supposed to be so excited about, and they were able to keep their policy they had for another year, it was $500 a month less, $6,000 a year less for that family. Here's some information we got today from Sherry at Shelbyville, Missouri, who said her son has had cerebral palsy his whole life. He's 18 now. They've had a medicine that works, that allows them to deal with this. Last year, a 3-month supply of this particular medicine went from $125 to $1,086, almost a $1,000 increase. But that may or may not be impacted by what's happening with overall health care policies. But what was impacted was her family's deductible this year went from $500 to $5,000. They were paying $500 on the 3-month supply of medicine. The year's supply of medicine would be a little over $4,000. They were paying $500 of that. Now they're paying all of that. And her view, like would be the view of most working families, is we had insurance we could afford. We had insurance that met our needs. Now we're paying $4,000 more than we were paying, or $3,500 more than we were paying. $300 a month, Madam President, to almost every family makes a big difference, and it particularly makes a difference for families that are struggling, families where somebody already has a health problem. Pete from Jackson, Missouri, receives health care benefits through his employer, but his wife and 2 children had health insurance through an independent carrier. His wife and children's plan will be dropped November the 30th this year. Their new plan will cost $1,200 per month instead of $530 for similar coverage that they have right now. And finally, Craig from St. Joseph, and by the way, this is the top of the list. If I had more time, I could certainly take more time with these stories. Craig from St. Joseph's out-of-pocket expenses went from $2,500 per year to $10,000 per year. He's paying that by going into his 401k retirement plan now. Now, if anybody thinks Craig and his family are better off paying $10,000 out of pocket than they were $2,500 out of pocket, and he's better off for having to drop into his retirement plan to pay for his health insurance, I'd like to hear how he's benefited from this new change in the law. People have insurance. Some of them had insurance before. They have insurance now through the exchange. They just happen to be paying, in many cases, a lot more and have a deductible that's a lot higher. That would be a great debate for us to have again on the floor now that we really know as a country what's at stake. What do we do to be sure that the best healthcare system in the world works better for everybody, and how do we make changes so that those who are outside the system get a better chance to be part of that system rather than penalizing everybody who had insurance, or many people who had insurance that they thought was working for them. And I would yield the floor to my friend from Rhode Island.